Senator Van Dyke is next.
Thank you, Mr. Chairman, and also a question for the sponsor. Mr. Chairman and Senator Wittich, I heard you talk about what you see as a problem with what's going on here is, you talked about our country essentially taking care of the young and the old, and I would add into that veterans, bringing more people into the system, and I don't disagree with that. But one thing that triggered in my mind is essentially, here we are, a legislative panel of the entire legislative body of the state who has offered to bring us into the system. We essentially, separating some committee work, interim committee work, we work 4 months out of every other year, yet we are offered year-round Cadillac version state health insurance. Are you confident that the folks deliberating on these bills can see this through a clear lens? More specifically, is there any inherent problems with 150 legislators, many of which are on state health insurance year-round, making decisions such as this? Mr. Chairman.
Mr. Chairman, Senator Van Dyke, I don't know quite how to respond. It is true that we're probably more privileged than most Montanans, and we'll be making decisions that they won't. This is a conundrum. There's no doubt about it. But I represent a lot of people in the private sector, a lot of people that have decided that they're handling their health care, whether it's through faith-based ministries or through other insurance vehicles. And currently the system is subsidizing many people, you're correct. To your question, Senator Gillen, I mean, hospitals and doctors are doing, quote, charity care, but somebody's paying for that. And it's usually the people who do have insurance are paying a little bit more so that, I mean, there are no hospitals that are going out of business. They say that they're losing money, but they're still all in business. And so there is currently subsidies. The whole, you're absolutely correct. Veterans care is another slice of the health care pie that the government is paying. So all of us are paying that through taxes. I'm just not convinced that we will be paying less by having mandates on people who, it will be tough for a lot of people to buy that insurance, or my understanding of the penalties through the IRS are hundreds of dollars. I think that'll be hard for a lot of people. And right now, if people do get sick, they may have to, spend down to the point where they have Medicaid. Then they will have care. Follow-up?
Just one more follow-up, Mr. Chairman. I guess along the same lines as my initial question is, you had sort of diverted into Senator Gillen's question about charitable care, and somebody pays for that. But your insurance and my insurance, somebody is paying for that too, the taxpayers of the state of Montana. So can we be ideologically consistent and support exactly what you're doing here?
Oh, Mr. Chairman, Senator Van Dyke, absolutely. I mean, if somebody who is not, currently doesn't have health insurance, if they need health insurance and it's an important thing, they should look for a state job. Then they will have the same health care that we have. And I'm not trying to be flippant, but there are jobs out there where health care is provided, and some people take those jobs for the particular purpose of having health care.
Thank you, Mr. Chairman.
Senator Hutton.